Hi there! This tutorial shows you how you can treat the neck, the shoulder joint and the shoulder girdle in a fast and easy way without much therapeutic finesse. My name is Andrea. I'm your audio guide through this video to explain techniques developed by Ulf Pape, who has been working as a physiotherapy and massage trainer for more than 20 years. And here we go! We begin with an exercise that is very important for the ensuing treatment. This exercise starts in the typical desk-sitter position. The back is rounded, the shoulders are rotated inwards, and the neck is tense. First, we straighten up and stretch our pectoral muscles with our palms pointing up to activate the outward rotators of the shoulder joint. We then move our arms backwards, which brings the latissimus dorsi and teres major muscles closer together. In this position, we engage our arms in a spiral-like movement, as if trying to draw an 8 with the humeral head in the shoulder joint. Repeating this complex sequence several times will relax the neck and shoulder girdle significantly. And if we use light dumbbells, the exercise will also improve shoulder strength. You should show this exercise to your patients before you start treating them, as it can be perfectly integrated into the treatment, as you will see in a minute. But first, we carry out two preparatory maneuvers. We put one foot onto the bench and position the knee next to the spine below the inferior angle of the shoulder blades. Our hands are near the sternoclavicular joints. Our middle fingers glide gently along the collarbone, with our index fingers melting into the fascia above the collarbone and our ring fingers doing the same below the bone. Then our finger pads pull across the coracoid over to the origins of the long head of the biceps muscle, and finally the greater and lesser tuberosities of the humerus. Then we give the descending part of the trapezius 3 good knees. For the next maneuver, we hold the trapezius with a firm grip. Our thumbs are positioned at the level of C7. We keep the pressure and ask the patient to incline and recline their head slowly forward and backward and back to neutral position. Then we ask the patient to turn their head to the right side and, in this position, to perform minimal nodding, head shaking and lateral flexion movements with the upper cervical muscles. The same maneuver is then repeated to the left side. This often helps release smaller subluxations in the cervical spine and lessens tenseness and discomfort. At the end of the sequence, the patient turns their head back to neutral position and performs 1 or 2 lateral flexions to each side before we release the grip. Now we position the leg that is on the bench directly next to the patient, as you can see here, and the patient starts carrying out the exercise shown at the beginning of the video, first assisted and supported, and then unassisted. And while the patient engages in this active movement, we can use this flow to treat potential ventral, lateral, dorsal and medial tender trigger and acupressure points by applying medium pressure with our finger and thumb pads. Also to be integrated in this sequence are massage techniques like kneading the descending part of the trapezius or deep frictions across the greater and lesser tuberosities. And once again, we can combine this with treating a variety of tender trigger and acupressure points, which are often identical or in close proximity. Start with the points that you are aware of, but you can, of course, also consult the relevant literature or expert websites for more and other points. Important are the regions above and below the collarbone, around the coracoid, and around the long head of the biceps muscle. Also important are the greater and lesser tuberosities of the humerus and the region around the inferior angle of the shoulder blade, especially on the lateral side directly next to the angle. On the back side, the important regions are those below the superior angle and, above all, the central part of the infraspinatus muscle. On the medial border of the shoulder blade, we work where the levator scapulae and the rhomboid major muscles insert. And we place our finger pads and thumbs on all the transverse processes of the thoracic spine. And now we ask our patient to fold their hands behind the head while we position our knee below the inferior angle and stretch the patient by bending them, so to speak, over our knee, first on one side and then on the other side. The knee gives a gentle push. And here we can also integrate a post-isometric relaxation where we ask the patient to perform a brief isometric contraction and then stretch them once again. And finally, we give a tapping massage and a gentle effleurage along the spine and down the back. The second part will show some more techniques to be applied with the patient sitting. We start with specific techniques for the cervical spine. The patient's arm is bent at a right angle in front of their head, the forehead placed in the middle of the forearm. We support this position with our own hand and forearm. If we now shift our weight slightly to the back and gently rock back and forth, with the finger pads of our other hand pressing into the foramen magnum, that is into the cervical muscles, we can move the patient into this light acupressure. We can also place our finger pads and thumbs on the transverse processes on both sides of the spine and give light pressure while at the same time slightly moving the patient's head by inclining and reclining it. We do this in the most gentle and careful manner. Then our finger pads glide back into the foramen magnum, but this time it's not us moving the patient's head. Instead, we ask them to move their head actively and carry out light inclinations, reclinations, lateral flexions and rotations against and into our finger pressure. We then place our fingers on the transverse processes of the cervical spine and ask the patient to perform small head movements against and into our fingers according to their own taste for more or less pressure. Having the intensity of movement and pressure determined by the patients themselves significantly reduces the risk associated with any treatment of the cervical spine. The next technique is that we support the patient's arm and rotate it backwards while at the same time kneading the descending part of the trapezius muscle and the levator scapulae below it. We then place our thumb pad next to the shoulder blade and give pressure while literally pulling the patient's shoulder into the pressure of our thumb pad. Using the patient's arm movement, we work our way downwards along the entire medial border of the shoulder blade, across the transverse part of the trapezius and the rhomboids, down to the inferior angle. Then the same back upwards, thumb after thumb, up to where the levator scapulae inserts. For the next technique, we engage the patient's forearm in a waving movement through the inward and outward rotation of the shoulder joint while performing a friction massage across the greater and lesser tuberosities. Then the patient moves their arm actively and unassisted, and we work with and against this movement to apply deep frictions across the entire rotator cuff. The last technique to be shown is one inspired by traditional Thai massage. We place one elbow right above the insertion of the levator scapulae and take the patient's hand. Our other hand holds the patient's elbow as a lever to pull the patient's arm backwards, which simultaneously stretches the pectoralis minor muscle. We then slowly build up a slightly stronger pulling pressure and ask the patient to circle their head slowly to the left and right, tightening and relaxing the levator scapulae again and again. This maneuver often helps release smaller blockades in the C1 to C4 region. That much for today, and thank you for your attention. Ulf's YouTube channel offers a broad variety of video tutorials addressing the treatment of neck and shoulder problems, including headaches. You will find many techniques and tips for and from the fields of medical massage, manual therapy, osteopathy, and physiotherapy. Ulf's channel offers you a great repository of ideas, which is continuously expanded. Further English language videos are in the pipeline. Subscribe to the channel so you don't miss anything.